So, hope you can hear me here. So, I would like to welcome you to our Illumina Symposium. My name is Anke Homann. I'm leading the Oncology Medical Affairs team at Illumina. And today I would like to... How does that work? To talk about the value of comprehensive genomic profiling in cancer care and precision medicine, of course. And as you all know, so in the last couple of years or even decade, there have been a lot of targeted therapies developed related to biomarkers. So what you can see here is that there are US-approved target therapies linked to biomarkers. On the top, you can see the US approvals for the years 2019 to 21, and at the bottom, the corresponding EMA, so the EU approvals. So some of those biomarkers are linked to specific cancer types. It's shown on the left side. And now we see more and more so-called pan-cancer biomarkers, so really independent of the cancer type, that those get approvals for as soon as the biomarker is detected in a specific cancer type, then the patient is eligible. So unfortunately, we don't have that many approvals yet in the EU. So it's currently listed here in the US. But I think it's a great trend to see more and more of these pan-cancer biomarkers. So at the beginning, and you have seen on the left-hand side that there were initially a targeted therapy linked to one specific biomarker, a specific gene, or even to specific mutation hotspots in the gene. So that's how companion diagnostics started, and that's why at the beginning this single gene testing was sufficient and therefore standard of care. And then when more and more biomarkers has been established, and for specific cancer types, then multi-gene panel testing became more and more standard of care. So that's what you can see then over the years, that there were these tumor-specific hotspots panel. But now where there are a lot of biomarkers and even the signatures are more and more coming. So that's why the comprehensive genomic profiling is today already in a lot of countries standard of care. The whole genome, whole exome, I think we have heard it already this morning, for example, from Denmark. So one for specific use cases, there is already today for specific cancer patients, whole genome, whole exome, transcriptome, routine use. And as we also heard already this morning, it has been discussed that in future, multi-omics will definitely be adopted in cancer care. What is now comprehensive genomic profiling, or CGP? So it's a test with a couple of hundred genes tested simultaneously in the same sample, the same assay, so that you can not only, you can see in here, these single gene mutations like the SNVs, the fusions and indels, etc., but you can also test the more complex biomarkers, because when you get more information, you can also detect TMB, MSI, or HRD, really important these days. So therefore, when you test really comprehensive, you can test for these not only multi-gene, but also for these really complex biomarkers, with the same sample at the same time. And I've shown you already on the slide before on the DNA level, but also it's very important that on the comprehensive genomic profiling, when you test on the RNA level, to cover the fusion events or the splicing events, and really detect on the event level, and not only that there might be on the DNA level and a breakpoint being available. The test approach, you can imagine that with this type, that you can not only test more comprehensive and you can test more these complex biomarkers, it's also that from a clinical actionable perspective, so that you can really test and therefore detect, or with a higher likelihood can detect those actionable variants, like shown in the past, where the single marker testing, then you really focused on specific areas or on gene. And with the hotspot panels, we had already increased that you can were able to detect more and more different type of variants. But with a comprehensive genomic profile, you can see here that you really comprehensively test and don't miss any actionable information. So what's now the value of the comprehensive genomic profiling? So first of all, as mentioned, the likelihood to detect an actionable variant and therefore identify a targeted matched therapy is higher when you test more comprehensive. So there's already data available. Just here one example where it's definitely an increase also in in the patient outcome at the end. Then I mentioned it already before that you've been able to detect and to test for really complex, like the TMB, HRD, etc., where with single gene testing or with the more targeted panels, you have no chance to really come up with a valid result for those complex markers. And in addition, so whenever you were not able to identify an actionable variant for your patient, then you might find a variant which, for example, is your patient will be eligible for clinical trial enrollment or maybe even off-label use, but definitely you get additional information which might help your patient. And I mentioned that the likelihood to identify an actionable variant linked to a clinical guideline is definitely increased. And this here, just as an example for NSCLC, approximately 50% of all NSCLC patients harbor related mutations. So therefore you could imagine that for lung cancer patients, when you would test one biomarker after the other, it's not only that it takes a lot of time, so probably there is not even sufficient tissue available to do these testing. So therefore, for these type of use cases, even the consolidation makes sense for your patient testing. It's not only the consolidation and to increase the likelihood that you identify an actionable variant, there is also data available that these comprehensive testing result in a real benefit for your patient. So on the left-hand side, you can see that the response rate is significantly increased when you from a therapy perspective, when it's a targeted therapy compared to a non-matched therapy. And this benefit is also already in publications shown related to the overall survival on the right-hand side. So that's not only the likelihood that you detect an actionable, but also then when you can select the right matched target therapy for your patient. This is a study showing that the comprehensive genomic profiling helps to identify those clinical relevant variants. So there was a study where they have tested with targeted hotspot panels and the comprehensive genomic profiling for a couple of hundred genes, and you can see that only around 40% of patients with a mutation in these patients has been detected with the around 50 or less than 50 panel testing, but that additional, or the 6% and an additional 40% only when you test really comprehensive, those variants were detected. And you could see here, because at the end, of course, it all is about actionability and improvement for the patients, and you can see that then really 20% of those were then finally treated with the right and recommended targeted therapy. So here are some additional cancer-specific examples, like for example for melanoma, where it has been shown that compared to traditional methods, that there was an increase in BRAF mutations detected in those patient samples. The second example is in breast cancer, where compared to, in that case, hotspot panel testing, that PIK3CA mutations in that case have been identified in the comprehensive ones, and these related resistance mutations or a specific percentage was missed in these hotspot panels. Then for colorectal, there is a publication where specific KRAS mutations were not detected with focused PCR testing compared to the CGP testing. And in the last example, a lung cancer specific example, where compared to standard molecular testing, so there were various type of standard tests available, where ALK fusions were there were more, around 35% more patients with ALK fusions and 21% more patients with EGFR alterations detected compared to those more traditional methods. So you can really see there's already a lot of data available in a lot of publications that CGP, at the end, also impacting the the overall survival and not only the test scenario in general. Oops. So here is another lung cancer specific example where the different test approaches were compared. So on the left-hand side, you see when no NGS was tested. And in this publication, they here calculated the risk that you miss a potential targeted therapy. So therefore, when you miss a specific variant, then of course you have no chance to select a specific or the specific selected specific targeted therapy. So you can see here on the yellow orange bar that when no NGS is used at all, that this risk that you miss a potential targeted therapy is around 40%. With targeted panels, so with the NGS, it's in that case non-CGP, but you decrease this risk already to around 13%, which of course is already a huge number to identify specific variants and therefore be able to identify the right therapy. And when from targeted panels you switch to CGP, you reduce this number even to 2.3%. So you really see that the likelihood to identify the actionable variant and therefore then decide for the right therapy for your patient is significantly increased with the comprehensive testing. Here at the end, from a clinical utility perspective, so as mentioned, there is a lot of benefit in these comprehensive testing. So at the end, when you identify not only the actionable information, you also have a chance to detect and to test for really complex biomarkers. And you have always the chance when, in case you are not identifying any clinically in clinical guidelines related information, if there is something identified which helps you with clinical trial enrollment, off-label use, or also, and we discussed it this morning in some of the sessions, also from a research perspective, there's of course a lot of information in. So I so far focused on the tissue data because tissue is definitely more advanced compared to liquid biopsy testing, but I would like just with 2-3 slides here to focus also on the liquid biopsy because also here comprehensive genomic profiling is already available and used in specific regions. And as you all know, there is a lot of advantages in the liquid biopsy testing. So for specific cancer patients where, for example, you would like to test on heterogeneity when you maybe from a resistance mutations perspective where you expect metastasis to harbor any resistance mutations, that you have a chance with the blood testing. It's not invasive, and sometimes there is just no tissue available or there is not even a way to get additional biopsy. So therefore, in general, there is a lot of benefits in liquid biopsy testing and also on the CGP levels. So there are already data available. It should be not replacing tissue because there is still a lot of value in the tissue testing. But I already mentioned that there are use cases when there is no tissue available or in general from a resistance testing and monitoring. So there is therefore a complementary use case for liquid biopsy, and there is already data available that also here for CGP testing, that whenever CGP was used in addition, complementary to tissue, and you can see here that adding the CGP testing significantly increased the number of patients to really identify something actionable. So there is therefore always the chance whenever there is something really in sample negative on the tissue side. So there is still the last possibility to test on the plasma sample and then identify something. And then of course the same benefits and the value, what I mentioned already before, is true here, so that you maybe find an additional actionable variant, but if not, it's again this, maybe there is something to enroll your patient into a clinical trial or off-label use or help with research analysis. And with this, the key takeaways, first of all, we all have seen that really on the biomarker side, there has been a lot of targeted therapies development, and this have revolutionized the cancer treatment in general. So the comprehensive genomic profiling has been now, or is already, has started to become standard of care in specific regions, and we see the adoption and implementation more and more with testing multiple hundreds of genes in parallel in one specific sample. There is already today a lot of data available that testing comprehensive, testing broad, helps not only on the response rate and on the overall survival, it really in general helps to identify the right therapy and the right targeted matched therapy for your patient. The CGP helps you to also with these new signatures, with these really complex biomarkers, to test for example, TMB and HRD and MSI, etc. It's really important here to test on the DNA and on the RNA level to ensure on the fusion level that you detect novel fusions, that you have a chance to really detect the real fusion event and not only on the potential risk that there will be in fusion. And this is independent of a cancer type. And as I've shown in one of the first slides, there are more and more pan-cancer biomarkers coming. And in addition to tissue testing, there's a lot of incremental value in additional complementary liquid biopsy testing. And even here, already data available that the CGP testing, so the comprehensive testing on the plasma side, gives a lot of additional information. And with that, I would like to thank you. And in case you have any questions, happy to take them. And we have also a table upstairs in case tomorrow maybe you have additional questions. We will be here and also available. But first of all, if you have any questions, happy now to take them. Thank you.